Hello, I'm Dr. Marla Shapiro, editor of ParentsCanada magazine. The following video clip has been prepared to help you with the challenges of being a parent. On behalf of everyone at ParentsCanada magazine, we hope you find it helpful.
It is important to move after you give birth. You know, in the past they would keep patients in bed for a long period of time, and in fact now for a vaginal delivery, once the epidural is worn off, if you have an epidural, once your legs are, the motor function comes back, women should be up and walking and ambulating as soon as possible, and for a cesarean section, usually by the following day or within 24 hours, women also need to be up and walking, and that improves their recovery specifically for the circulation in their legs, because the postpartum time is a much higher risk period to develop a blood clot in the legs, and those could be potentially very serious. For a routine, uncomplicated vaginal delivery, really fairly quickly they can start to resume activities and exercise. I would say even within 2 weeks or 3 weeks, if they feel well enough. And of course all of that has to be individualized, depending on how the woman feels. And I always tell my patients, you have to read your own body and know when you feel ready and when too much is too much. And for a cesarean birth, we usually would say 4 to 6 weeks. Although that may be even a little bit long. Also for an uneventful, uncomplicated cesarean, maybe even by 3 to 4 weeks. If some light exercise, a woman may be able to resume again if they feel well enough and they're not having any problems or symptoms that are bothering them. Less than a quarter of patients will be at their pre-pregnancy weight by their 6-week checkup. Most patients, though, should be at their pre-pregnancy weight by about 6 months postpartum. You know, and some women do find that they always will have an extra 3 or 4 pounds that are difficult to lose, but that's common. For the perineum care is, of course, every time you go to the bathroom to urinate or to have a bowel movement, we usually have a spray bottle, a spritz bottle with warm water, and you just spray yourself. That's all that's really needed is warm water. And of course, wiping yourself should always be from front, to back.